Hi, my name is Jasmine Pope, and I am going to walk you through on how to administer medication through an NG tube. So first things first, I would gather all of my equipment, a syringe with the container that it goes in. I'm going to grab medications. I'm going to compare it to the MAR prior to going into the patient's room. I'll knock on the door, introduce myself. Hi, my name is Jasmine Pope. I'll be your nurse today. I'm here to administer medication through the nasogastric tube. First things first, I would personally make sure that the head of the bed is elevated 30 to 45 degrees. I would make sure I state my reason for being there and what we're going to do. I would have the patient state their name and date of birth. I would again compare the MAR and the orders, making sure that I have the correct medication. I would wash my hands, I will put my gloves on, and then I'll do my third check again with the MAR and the medication. Next, I'll gather my syringe and my sterile water. Prior to crushing the pills, let's say we're giving this patient Zoloft and a multivitamin. Prior to crushing the pills, I'm going to check for placement. And the way that I'm going to do it is I'm going to withdraw gastric content from the nasogastric tube and probably put it in a little medicine cup. And then I'm going to take a pH strip and test the gastric content. And if it's clear, that means that placement is correct and we are okay to finish administering the medication. From there, I'm going to make sure that I crush each medication separately. So the Zoloft will go in one med cup with about 10 ml of water, and the multivitamin will go in its med cup crushed with about 10 ml of water as well. So I'll give the Zoloft first. I would first flush the nasogastric tube with about 30 mLs of water, shut it. I would then withdraw one of the medications, administer it. I would flush again with about 5 to 10 ml of water in between all medications. And then I would administer the next medication. And then I would make sure I flush it at the end with about 30 to 60 mLs. And I want to rewind. Going back to comparing the MAR to the order, we're checking for the right patient, drug, dose, time, and route. And that's how I would administer nasogastric medication. And I wish I had the supplies to do it. All right, thanks.